Hello everyone and welcome back to my channel. So today's video is important because I'm going to take you through a very important topic. Now, I personally believe that health awareness is a basic human right, and whether we are a medico or a non-medico, every individual has got the right to know each and every details about the mechanisms of any kind of disease happening in our body, because only when we know the mechanisms and the processes that keep happening in our body, only then we will be able to take precautionary measures and keep ourselves healthy. This awareness or this knowledge will give us an opportunity to be health conscious, and that will be one step ahead to a healthy and a happy life. Being a pathology student has given me the opportunity to go through the details at the molecular and cellular levels of almost every kind of disease, whether it's cancer or non-cancer, that I should stress some importance on these kind of topics which is somewhere or the other overlooked or missed by a lot of patients and students. This video is also for the second year MBBS students because I'm going to take you through Robbins, all the images and the flowcharts of Robbins. We're going to do this chapter or the topic of obesity completely now, and also for the NEET PG or the postgraduate entrance going students, because I'm going to also highlight the MCQs. These topics are very, very important from whatever kind of perspective you are, and even if you're a postgraduate student, then obviously this is a long answer question, you know that. And also from the perspective of healthcare knowledge, this topic is of utmost importance because obesity forms the center of metabolic syndrome, and we know that metabolic disease or metabolic syndrome is the basic root, the basic cause of so many kinds of diseases that we encounter in our day-to-day life, like diabetes, hypertension, cholesterol, dyslipidemia, even cancer. So how is this obesity linked with cancer? What is the mechanisms? Why does this happen? What is the neurohumoral mechanisms taking place here? What are the molecules involved, and how does it actually leading to so many disastrous consequences? So I can't stress any more on the importance of this topic, and without further ado, let's dive straight into Robbins. So, obesity is defined as an accumulation of adipose tissue that is sufficient of magnitude to impair health. We know the BMI normal is 8.5 to 25. More than 30, it is obese. 25 to 30, it is overweight. Now, obesity is associated with several of the most important diseases of humans, including type 2 diabetes, dyslipidemia, cardiovascular disease, hypertension, and cancer. So you can see these are the kind of diseases we encounter on a day-to-day basis. So how important is this chapter, isn't it? So another important point is that central obesity, in which excess fat accumulates preferentially in the trunk and the abdominal cavity, which means around the viscera. So whenever there is accumulation of fat in the surrounding the viscera, that gives rise to central obesity, and this is more dangerous than the peripheral obesity, in which the fat accumulation is subcutaneous. So subcutaneous fat accumulation is still okay, but if it is a central obesity, it is more dangerous. Now there, to understand this mechanism is a very, very complex mechanism. You can see this image, okay, and you can also see this image. These two are very complicated, right? So before starting off, I want to make you understand that there are two kinds of systems happening in the body. One is the catabolic pathway and one is the anabolic pathway. So catabolic pathway and anabolic pathway, these two are the energy consuming and energy expenditure mechanisms. So the entire game of obesity lies with these two mechanisms. So basically, first you need to know what is catabolic mechanism. Now, what happens in catabolism? In catabolism, there is a decrease in the food intake. Okay, and so this is the most important dictum, that in the catabolic state there is a decrease in the food intake and there's an increase in the energy consumption. And just the opposite happens in case of anabolic, a state where there's an increase in the food intake and a decrease in the energy consumption. Now you must know the importance of orexin. What is orexin? Orexin means it causes increase in the food intake. Okay, so orexin causing an increase in the food intake, and any kind of molecule or hormone which increases the food intake is known as orexigenic hormone or molecule, and the opposite is anorexigenic molecule. So this is just the basic outline, and now I'm going to take you through each of this individually. I'm going to talk about this entire process at one place, because if I divide it like this, you will never understand. So basically what happens is there is a afferent signals. There are some afferent signals. This is the neurohumoral circuit I'm going to explain here. It happens in the hypothalamus, or the rather the arcuate nucleus of the hypothalamus. Okay. So what happens is basically there is some afferent signals. What are the afferent signals? I'm going to talk about it next. From the afferent signals, there is some kind of message which is being transferred through the first order neurons, then to the second order neurons, and then the ultimate effect is happening via the efferent signals. So all these are different in these two different pathways, which is the catabolic pathway and the anabolic pathway. So what exactly happens here? So now let's talk about this. See, so what are the afferent signals? The afferent signals are the leptin from the fat cells, ghrelin from the stomach, peptide YY and glucagon-like peptide 1 from the ileum, and insulin from the pancreas. So you can see here all this leptin, ghrelin, insulin, peptide YY, all of these are the energy sufficient signals. Energy sufficient signals mean what? Already the body is having sufficient energy. So it will decrease the food intake, right, and it will increase the energy consumption. That's what we have learned over here, and that is why in case of energy sufficient signals, the catabolic circuits are getting activated, which will cause an increase in the energy expenditure and decrease in the food intake, as you can see here. And all these energy sufficient signals will inhibit the anabolic circuit. Obviously, automatically, if the catabolic circuits are getting activated, the anabolic circuits will automatically get inhibited. Okay, so this is just the basic outline. So now you must know that this is just the first step. That means these afferent signals. So what are the afferent signals? I've already mentioned. Now once let's go one step higher. So from the afferent signals, we have already done this part. Okay, so now from the afferent signals, we are going to the first order neurons. So in these two pathways, catabolic and anabolic, what are the two first order neurons? So in the catabolic pathway, the first order neurons are the POMP and the CART. And what are the second order neurons? The MC3-4R. And what is the hormone activated here? It is the alpha MSH. So if we come back here, see. So in case of catabolic pathway, the first order neurons are number 1, the pro-opiomelanocortin pump and POMC and cocaine and amphetamine regulated transcript, or the CART neurons. Okay, and number 2 is the, so this is number 2 will come under anabolic, so we'll do that later. I'm just talking about this part. Okay, this is the one which is playing an important role in the catabolic. Okay, so this will relay into this second order neurons. So what are the second order neurons? These are the melanocortin receptors 3 and 4, MC3 and MC or 4R, and they receive signals from the first order neurons. So this, so you can now you can understand that from this is going to this second order neurons, and now via these TRH, CRH and BDNF. So what are the full forms? The thyroid releasing hormone, the corticotropin releasing hormone, and the brain derived neurotropic factors. So all of these are the efferent signals of the catabolic pathway. As you can see here, all of these are the efferent signals of the catabolic pathway, and the ultimate result is that there's going to be a decrease in the food intake and an increase in the energy consumption, as I've already mentioned. So this is one pathway, catabolic pathway. And why does that happen? When does that happen? When the body is in a kind of a state where the food intake is no more required, when there is an energy sufficient state. Okay, next is the anabolic pathway, where the first order neurons are the NPY or the agouti related peptide. So you can see here in neuropeptide Y and the agouti related peptide, which is the AGRP, is the first order neurons. Second order neurons are the Y1 and Y5 receptors. Okay, and it functions via the MCH. Okay, it functions via the MCH or the melanin concentrating hormone and the orexins. So these two hormones is now functioning as the efferent signals of the anabolic pathway, which will cause an increase in the food intake and decrease in the energy consumption, just the opposite of the catabolic pathway. So this is basically the pathway for the anabolic one. So these two are different. Okay, and don't get confused. I have mentioned here so that it just comes under one chart. First order mein these are the first order neurons, second order mein these are the second order neurons under these pathways. This is the ultimate effect, this is the ultimate effect, and these are the efferent signals of this pathway and the efferent signals of the another pathway. Here itself I want to mention that orexigenic means it is anabolic, means it will increase the food intake. So what are the hormones? The leptin, the insulin is anorexigenic, means it will decrease the food intake. Okay, another important point is the adiponectin, it's known as the fat burning molecule. It increases insulin sensitivity, so ultimately it is also anorexigenic. Okay, so we've already done this part. As you can see here, this is how the mechanism is happening. But if this doesn't regulate, if these energy consuming and expending mechanisms are not functioning properly, then the body will keep on, there will be a continuous increase in the food intake, and that will ultimately lead to obesity. So if this mechanism is not balanced, then this food intake, if it is not getting decreased when required, then obviously there is going to be some kind of effect, and that is the obesity. So what is leptin? Leptin is secreted by the fat cells. Its output is regulated by the adequacy of the fat stores. It reduces the food intake by stimulating these molecules. So thermogenesis is an important catabolic effect mediated by leptin, and you can see here that whenever there's a mutation in this melanocortin receptors, then that leads to massive obesity. So all of these mechanisms, every point it is important, because any kind of mutation anywhere will lead to obesity. Okay. Okay, now what is adiponectin? It's a fat burning molecule. It stimulates the fatty acid oxidation in the skeletal muscles, thereby reducing the fatty acid levels. Because, if there's an excessive fatty acid, if the fatty acid is not getting reduced or broken down, okay, these excessive fatty acids will cross the blood-brain barrier. It will enter the hypothalamus, where they are sensed by these microglial cells, and these cells will respond by releasing inflammatory factors, okay, and that will cause leptin resistance, thereby blunting its anti-adiposity signals. So once there is leptin resistance, there will be no action of the anti-adipose effect of leptin. So what will happen? The fat will keep on accumulating. Okay. Adiponectin is known as the guardian angel against obesity, but again, as I mentioned, that it has to be properly regulated, else there's problem. So adiponectin all decreases glucose production in the liver and increases insulin sensitivity. So important, protecting against the metabolic syndrome. Adiponectin has anti-inflammatory, anti-atherogenic, anti-proliferative, and cardioprotective effects. Its serum levels are lower in the obese than in the lean individuals. So in the obese individuals, its serum levels are lower. Okay. So obesity associated insulin resistance, type 2 diabetes, and non-alcoholic fatty liver disease, all these things can happen if this is not regulated properly. So you understand that how and why these things keep happening. Okay. So obesity ऐसे नहीं होता है that you just want to eat food and you're eating, that is different thing. Obesity is again a completely different thing. So what is ghrelin? Now ghrelin normally rises before meals and falls 1 to 2 hours afterward, but this drop is attenuated in obese individuals. Ghrelin levels are lower in obese individuals. The rise in ghrelin levels is much reduced in individuals in whom gastric bypass surgery is performed for the treatment of obesity. So you understand that normally what happens is they increase and they fall afterwards, but in obese people this ghrelin will not fall. So ultimately what will happen? There will be an increase in the food intake, and that will lead to obesity. But when there's a gastric bypass surgery, then there will be an increase in the, then this ghrelin levels will no more be increased. So this is like an important question. Okay. Now this another molecules implicated are the PYY and the GLP-1. Next is which has got a role to play in the type 2 diabetes. Okay. So, what are the consequences? Now, this was something I was talking about, that you should be paying attention to this, as you need this knowledge in your life, practically in your life, that central obesity is associated with an increase in the overall mortality, and is a known risk for a number of conditions like type 2 diabetes, cardiovascular disease, and cancer. You see, so many important diseases keep happening because of this. At It is known as the metabolic syndrome, characterized by abnormalities of glucose and lipid metabolism coupled with hypertension and a systemic pro-inflammatory state. So basically, all the metabolism that keeps happening in our body, all of the metabolisms are getting affected here, and that's why it's known as metabolic syndrome. So you can see how dangerous it can be. Okay, so if there's an excessive body weight or obesity, there's insulin resistance, and once there's insulin resistance, it will lead to metabolic syndrome. If there's hyperinsulinemia, then there is a decrease in the binding factors, which will lead to increase in the free IGF. Okay, which will cause, which will increase the cell proliferation, leading to cancer. And it will also increase the sex hormones. You can see it will increase the estrogen, and you know that estrogen is a fertile soil for breast cancer, ovarian cancer. So if this estrogen is increasing, if these ovarian androgens are increasing, it will again cause cancer of these systems. So they're so important. You can see how these are linked with each other. Now, obesity associated with insulin resistance and hyperinsulinemia, type 2 diabetes, inflammation induced by interleukin 1 and other factors contributes to insulin resistance. It will ultimately cause hypertension. These patients, they have hypertriglyceridemia and low HDL cholesterol level, coronary artery disease. Yeah, what is left? Every kind of disease is being taken care of by obesity. So what is left? I don't know. Everything is happening here. Non-alcoholic fatty liver disease, cholelithiasis or gallstones, obstructive sleep apnea. Marked adiposity is a predisposing factor for development of degenerative joint disease, osteoarthritis. Markers of inflammation like CRP and pro-inflammatory cytokines like TNF are elevated in these obese patients, and in particularly patients with central obesity. So it's a very, very, very important thing to understand, if not from your exam point of view, but also but from your daily life. Now, coming to this very, very hard word, which is obesity and cancer. Yes, there is an increase in certain cancers in overweight patients, like the cancer of the esophagus, thyroid, colon, kidney in men, and the cancer of esophagus, endometrium, gallbladder, and kidney in the women. So what happens is there's an increase in the insulin level because of insulin resistance. Okay, and this hyperinsulinemia, what will it cause? It will ultimately cause an increase in the free IGF, which will activate the RAS and the PI3 AKT pathway. You know that this is the pathway for neoplasia, right? So neoplasia mein, this is the pathway, and you know that this promotes the growth of the neoplastic and normal cells. So there's going to be an increase in the normal cells and neoplastic cells, because free insulin like growth factor or IGF-1 will activate this pathway, which will ultimately cause cancer. So you can see how important is this. Okay, obesity has effect on the steroid hormones. Obesity increases the synthesis of estrogen from the androgen precursors, and you know that whenever there's an increase in androgen synthesis, the estrogen synthesis will be, the estrogen availability in obese patients will also increase by inhibiting this binding protein. And adiponectin secretion from adipose tissue is reduced. Okay, because adiponectin is a good hormone. It will suppress the cell proliferation and promotes the apoptosis. But since in the obese patients this adiponectin secretion is reduced, so that will ultimately cause proliferation of the cells, ultimately leading to neoplasia. So this pro-inflammatory state which is happening is also associated with carcinogenesis. So there are so many mechanisms by which obesity can cause cancer. I hope that makes sense to you. Now, yes, there are also certain other endogenous carcinogens and exogenous carcinogens. Here I want to mention one very important point, and that is this important point. Actually, this has got a lot to do with one of my personal life incident, and I'm going to share that also someday in one of my video, which had left a very sad a very bad impact. So this is so important, and I've seen this happening. That's why I have taken this point to tell you that this words which are written in Robbins, this actually happens. This actually turns into reality in practical life. So see, high animal fat intake combined with low fiber intake has been implicated in the causation of colon cancer. ठीक है, सो एनिमल फैट अगर हाई है उसके साथ अगर फाइबर बहुत लो है, दिस कॉम्बिनेशन ऑफ डाइट इज वेरी वेरी डेंजरस. ठीक है, इट विल लीड टू समथिंग कॉल्ड एज कोलोन कैंसर, एंड दिस इज समथिंग विच आई हैव सीन in my personal life, and this is a very 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 true statement. So with that, I think I have completed this part and I've made you understand the importance of this topic. This flow chart is very complicated. Okay, this flow chart is very complicated. Once you start reading this alone, probably somewhere or the other you may get lost. So that is why I made it very very simple, but again, if you don't revise, you will forget it. So I hope that I have been able to throw some light on the importance of this topic in our lives. And obviously, you have to kind of keep a proper weight on a body. Weight balance is very very important, and I'm not asking you to be lean and thin, but the point is that I'm trying to make you understand is that this is important from the perspective of your exams and also from the practical knowledge, because this obesity is something which is, I think, ignored, but then this is actually leading to a very serious consequences. So I hope you enjoyed watching this video and also learned a lot from here. I have also mentioned the important questions, MCQs that are being asked as a very, very important topic. And if you like more such videos, then mention in the comment section below. And if you have any more personal query, you can also mention there. I'm going to come back soon with another very important topic. Till then, take care, keep studying, and thank you for watching.